It certainly gives me great pleasure to introduce our next speaker, Dr. Simon Yu, who's also a native St. Louisan. Just briefly, if you were at my lecture earlier about nutrition, a lot of it has to do with influences and information that Simon has shared with me over the years. And Simon, you know I'm forever grateful for that because it really has changed the way I practice dentistry, biologic dentistry. Just a little bit on Dr. Yu. He received his BS Biology at the Washington University in 1977, received his master's degree in biology on immunology at the University of Missouri St. Louis in 1980. He received his MD at the University of Missouri Columbia in 1984. He's certified in acupuncture from the University of Stanford in 2007. He's also board certified in internal medicine. And Simon probably won't say this, but I will. He just recently published a new book called Accidental Cure. He has a booth in the exhibit room. You might want to look at that. It's very interesting how he shares medical treatments, and also he correlates the dental. And one of the things that he taught me too is how important dental is in the treatment of his patients. And without doing this, sometimes he will not see the successful results that he sees. So please welcome Dr. Simon Yu.
Thank you, Mike. Can you hear me okay? All right. Well, thanks for the invitation for IAOMT. I had basically 48 hours to prepare for my lectures. So what I decided to do was, I do give lectures on parasite, and I decided to combine also dental and parasite in a relationship, why it is so important for you to be aware of it. And so I do give a lecture called Think Parasite When the Latest Medical Therapies Fail. So I expand to Think Parasite and Dental Problems When the Latest Medical Therapies Fail. That is in my book, Accidental Cure, talking about those phenomena. And I will make a disclaimer. I do not have any financial interest of the product in my talk or with any companies offering grant monies for this continuing dental and medical education program. But I do have my book, which I hope is not a conflict of interest. So let's start with parasite. Parasite is a lot more common than you may think, and you may be wondering, what does parasite has anything to do with a dental problem? Now, first I got into this parasite problem with a patient with a lot of allergy problems. A lot of cancer patients have a parasite problem. But also those what we call incurable dental problems. They don't respond to your regular biological dental care. You have to thinking about maybe there are some other infections, actually systemic parasite problem. I'm not talking about oral, there's the protozoa, amoeba type of infection, systematic type of infections, and why those incurable medical problems are also associated with hidden parasite problems. Our body will try to self-regulate to heal itself, but we have all these what we call disturbances. Nutrition and diet, Dr. Mike Ramey talked about that, vaccination, insecticide, preservatives, medication, chemical stress, surgical scars. But we're talking about also parasite and hidden dental problems. We also see more and more new infections and toxins, psychological stress, heavy metal pollutions, acidosis, electromagnetic field pollutions, allergies, and what we call miasmatic and constitution. So if your mother have a breast cancer, your sister have a breast cancer, your grand-aunt has a breast cancer, there are certain probability and tendency you will develop breast cancer. But that has a lot to do also with the environment you're living in. That's what we talk about, genetics and epigenetics. But we're going to emphasize on parasite and dental for these lectures. So what are the objectives? First, you have to recognize that parasites are often overlooked for common medical problems in internal medical practice. We have a new way of detecting parasite by using current technology based on EAV and acupuncture meridian assessment, and how to optimize using parasite medication and prevent from recurrent parasite infections, and to understand the incurable dental medical problems and in relationship with infections, especially parasite. So we have to understand a little bit basic concept of acupuncture, biocybernetics, and energy medicine. And I have many articles talks about called curing the incurable by measuring the invisible energy field based on acupuncture meridian assessment. So I'm going to do some of the case studies as to make it relevant to you. So I have here a 58-year-old man with cancer of the left leg, primary cause unknown. I saw him first time in November of 2009. His initial symptoms was with the left leg pain and low back pain in summer of 2009. CT of the abdomen pelvis showing mass of 11.3 centimeter by 4.3 centimeter mass, multilaterally solid and cystic mass to the proximal femur, osseous pattern, lytic, consistent with advanced disease with subcutaneous edema within the left eye, metastatic disease to the L4 and T9 vertebral body. I know you cannot read this. Basically saying he's got non-small cell adenocarcinoma of the bone and the soft tissue. Prognosis very poor. This is from his PET scan, and this is the left side. This is a tumor mass right here. You can see that. It's a huge mass. We also see metastasis to L4 and T9. Just look at the size of that. And this is from the CT scan, massive swelling in his left eye. The bone was about to break and they put the rod in. And all my patients, I measure meridian point, 40 point, right hand, right leg, and left leg. Green means within normal range. Blue means it's out of balance, it's too low. Red means too high, means there's an inflammation. And they'll give you numerical scores, and he's got 23 out of 40 meridians so out of balance. And each meridian gives you a clue where the problem might be. So he had a cancer of unknown primary source and placed a pin in his left leg and started chemotherapy and developed severe ulceration. Chemo stopped and sent him home home under the hospice care. Basically sent him to die. And when I saw him, he was in a wheelchair. And based on those acupuncture meridian assessment, I decided on ivermectin. It's a very common parasite medication we use for the dog, horse, and sheep. And in November, I also promote levamisole 50 milligram 4 times a day for 10 days. That was actually in December. And by the time January, when I saw him the third time, he reported left leg swelling was gone after Christmas, feeling much better, pain is much better, and lost 20 pounds of fluid. And when I measured his meridian, only 3 out of 40 was out of balance. So I know I'm in the right track, except this is the right side of the dental problem, and the left side he also have a dental problem. He has some allergy problems there. So I can track, based on his meridian system, which direction he's going. And in February, he was taking a vacation in Florida, and in May, he was able to attend his daughter's wedding. And he saw actually his oncologist in May of 2010, X-ray of the left femur completely healed, tumor gone, no sign of a cancer, patient is feeling well, ambulating, and agreed to complete dental work and DMPS chelation therapy for lead and mercury toxicity. And if you look at his picture here, so I do almost all my patients, when I see them first visit, I do infrared thermal imaging of their face. It's just one of the basic screening tests. So look at from here. On the left side, here is a hot spot here. White means it's a hot spot there. And look at from here, he's got some underactive thyroid problem, looking for any symmetry, and doctor probably most of it can tell you a lot more than I can, but he has some slight difference in temperature. He will tell the difference, and you see he may have a TMJ or whatever problem he may have. But he's got dental problem there. All my cancer patients, I look for heavy metals using DMPS, and he's got very high in lead, mercury, and platinum from his chemotherapy, and he also have a high in tungsten. You have to look for those heavy metals, and he's there. Almost all cancer patients, they have a significant heavy metal burden. All my patients, I do hair mineral compositions, looking for any abnormal mineral analysis they may have, and you will not see lead or mercury in the hair unless you do actual provocation tests. So although I do all my patients hair mineral composition, looking for mineral compositions, I never rely on them as a definite diagnostic test unless you do challenging tests with your chelating agent. I do call electrointercellular scan, and we can predict what kind of neurotransmitter you have, what kind of hormone you have, what kind of oxidative stress you may have, and all those pH we can measure actually and predict them very fast within 5-10 minutes. All my patients, I do food allergy tests on, he doesn't have much problem. And the reason he doesn't have much allergy problem is, although I predict in meridian systems he may have an allergy problem, his immune system is suppressed, and sometimes we will not see that. He will not show hardly any allergy problems. So one of my message to you is always thinking about dental as part of the equation. And you are a dentist, so that's your profession. But for me as a medical doctor, I always look at dental as actually part of my equation. It's right there. It's a hot spot right there. He's got a root canal there. So when you're looking at the dental, I'm looking at a dental medical complex problem, not just as a dental problems. And you probably know so much more about amalgams, root canals, galvanic currents, cavitation, TMJ, implants and heavy metals, bonding materials, metal allergies, composite materials, high-speed drill as a potential problem you may have, proprioception problem. And what about this parasite and bruxism? When people have this bruxism and TMJ-like problems, you have to think about infections. And I learned this concept from my patient who was a Mexican. And what she told me was when these Mexican children have this bruxism, this Mexican pediatrician put on parasite medication. So if TMJ patient doesn't respond, proprioception problem doesn't respond, you have to think about maybe there is an infection and might be possibly parasite problem. And what about those amalgams? If you grind them, they were grinding at night, it will release the mercury at a much faster rate. And thinking about also concept of polymorphism of bacteria, fungus, and parasite. They're all interrelated and interfere whatever you're trying to do. If you don't address a parasite problem, you may continue to have dental problems. So, I saw this lady actually 2 days ago. As a Russian lady, 47-year-old, with intractable headache, chronic sinusitis, nosebleed, leg tremors and shakes, and what I call your nightmare patient with 10 root canals and 7 implants. Again, quick thermal imaging tell you right there, she got the hot spot right in the dental problem. Because what we're looking for is an asymmetry. Whenever there's an asymmetry, we know there's a problem the one side or the other side. And she got some thyroid problem there. The meridian measurement showing 18 out of 40 meridians out of balance. Those are, again, all those blue means out of balance. Here's a dental, and there is a dental. That's one of the lowest reading. And this is our Panorex dental X-ray with all those implants and the root canals. And so I saw 2 days ago, one of the things I'm telling her is that don't do any more dental work than whatever is absolutely necessary. If you have any pain, they have to pull out, yes, go ahead and do it, but don't do any more dental work until I can help you to balance all your meridians except the dental problems. So when I put ivermectin, levamisole, those are 2 parasite medications, I put them on with a wormwood complex. So the herbal parasite medication is a wormwood, black walnut, and clove oil, basic body cleansing herbs, digestive enzyme, and probiotics. From the tray, I can balance 38 out of 40 meridians balance out except the dental problems. So I know I will be in the right directions. And I told her, taking care of the GI problem first before you get into the dental issues. It's very important. If you get into dental work right away, those infections with the root canals and implant, they will not heal properly because her immune system already suppressed. Why? Those people who doesn't respond very well because she got so much infections. They have to be taken care of first, and then she can get the dental work to be done. And she'll have a much better success rate for your dental work, what you're doing. What about here? Another case with a malignant hypertension. 51-year-old female with a blood pressure of 260 over 160. Blood test normal, EKG normal. I check for EAV, acupuncture meridian assessment. Basically 1 out of 54 meridians are out of balance, which happened to be a dental problem. And her main problem was a bite, TMJ, proprioception problems. I sent to the dentist to correct the bite the very same day because it's a medical emergency. And her blood pressure came down to 140 over 85 that same day. When next time she came back to my clinic, blood pressure 140 over 85 from 260 to 160 by correcting the bite. Here's one quiz for you. He's a 32-year-old man with a newly diagnosed MS. He had 14 amalgams and came to see me on September of 2008. Now, this is a piece of cake for you, right? Got 14 amalgams and MS. Huggins talks about get the amalgams out, right? Let's look at the case here. Chief complaint. He noticed 1 month history of double vision, poor coordination, extreme fatigue, body ache, shortness of breath. Patient was at St. Anthony's Emergency Room for evaluation 3 weeks before he came to see me, and MRI was consistent with MS with brain lesions. And patient was admitted and started on steroid. He's got 14 amalgams, plus he's got several root canals. When I check his EAV, acupuncture meridian assessment, he's got problem in gallbladder meridian, allergy, central nervous system was very low in 20s. Ideal should be 50, normal range about 45 to 55, and his reading was in 20s. I did Simon ivermectin, and to balance his gallbladder meridian and metronidazole, and recommend patients do not to remove the amalgams by dentist until parasites are clear. I made it clear, please don't do any dental work until we clear his GI problem first, because you're going to have a lot of probable side effects if you just jump in to remove the silver fillings right away. And what he did was he went to another neurologist for a second opinion at the teaching institution 6 weeks later. And what they did was they did a repeat MRI was done, and there was actually no brain lesions. The lesion actually disappeared within 6 periods, and his clinical symptoms has been dramatically improved. So one of the schools says remove all those fillings when you have a MS, especially with the 14 amalgams. But here I am saying, wait a minute, let's look at the whole body. What's going on? Let's start with the GI problem first, and then you can get the dental work to be done. But you know how difficult to convince the patient when they're feeling better? They don't want to spend money to remove all that 14 fillings and root canals. It's such an effort to convince the patient to remove those fillings. It took him 2 years after that. By then his symptoms are recurring again, because just the parasite cleansing alone is not enough, because he had to get the filling to be removed too. So I want you to understand both sides. You can approach from the dental or from the whole body first. For my preference is look at the whole body first, and you have to work together with the dentists and medical doctors together who understand this phenomenon. So many neurologic conditions are caused by parasite, heavy metals, and dental problems, and also need to be differentiated by EAV, acupuncture meridian assessment. Right now, 1 out of 2 men will develop cancer during their lifetime, and 1 out of 3 women will develop cancer during their lifetime. Now, cancer has become more than epidemics. I know some of you will have a cancer, or some of your family members will have a cancer right now. And all those cancer patients have parasite problem at least 99% of the time. They all have some form of a dental problem at least 95% of the time. They all have a heavy metal problem, and also have what we call unresolved emotional conflict. Every known cancer patient I've seen have all those underlying problems. So why parasite problems are overlooked? Because we assume parasites are only in third world countries. We have a worldwide global migration and change in our diet. We have a global climate changes. And the cell analysis for parasites is simply not a reliable test. I don't even do cell tests anymore. Most parasites are outside of the intestinal tract. We have to think about all those cofactors from environmental pollutions and poor minerals and nutritional content in our food. And the animals, the dog, cats, and other pets are at home, and many people will actually sleep with them. Parasites have a very complex life cycle and very complex ecosystem. Parasites are deceptive, adaptive, and difficult to eradicate. Parasites have pleomorphic, complex life cycle and have a what we call community of ecosystem. They go through different life cycle. They don't usually have just one parasite. Most people have a multiple parasite problem with different bacteria and virus they carry with them. And with those, they also have a fungal yeast problems as a together with heavy metals and pollution. They're all together as an eco-complex. So we have to break that cycle. If you focus on virus or bacteria, you're not going to hit the parasite, they will perpetuate. But if you hit like a heavy metals and major dental problems and then get the parasite, sometimes we see the first case where cancer disappears. We see some of those dramatic cases, we'll see that if you can break the cycle and get rid of the parasite. So let me give you another case. It's a 52-year-old Air Force colonel from White House. He's a White House staff. Last time he came to see me in May of 2009. His last appointment at the Navy Medical Center Bethesda in March of 2009. And look at some of his diagnoses. He's got irritable bowel syndrome, severe fatigue, chronic diarrhea, lumbago, low back pain, fever of unknown origin, esophageal reflux, chronic sinusitis, and allergic rhinitis, vestibular neuronitis, dizziness, sleep apnea. I think there's some missing down here, and one of them is called empty cellar syndrome. This is again one of the called nightmare case, and somehow he found out I treat parasite, and he knows that I was in Bolivia. And let me see here. Yeah, here's a Air Force colonel with his. He's got this. You see the difference in temperature. He's got chronic sinus problem right away. He's got slight temperature difference. He's got some dental problem there. And I was in Bolivia in year 2001. And I was a lieutenant colonel at the time. We do have a vet. People line up to get the medications, and we saw about 10,000 Bolivian Indians. And they all got parasite medication. We dispensed everybody with either mebendazole or parental palmoid, one of the cheapest parasite medications available. We just dispensed them automatically. We took same parasite medication before we left from La Paz, took same medication to make sure we don't get contaminated. And we think it is just from Bolivia or South America and Mexico. I see so many people coming from Iowa, California, East Coast, whatever. They all have these what we call incurable problems, the incurable dental problem. There's so many holistic medical doctors, and they're not addressing parasite problems. And this Air Force colonel was in Bolivia year 2005. He was attached as attaché to the all those the ambassador, where he would travel around the country in South America for the coca, there's a drug trafficking problem. He's monitoring those things, and he actually had to often eat with those local papers, and he got sick, and he almost died. He was air evacuated from La Paz to the Walter Reed, and he was in the the Navy medical centers, and they tried everything they could to treat for parasite and everything, but he never fully recovered. And he was still functioning as a White House staff, and he heard about my practice, and he drove down to see me. And let me see here. This is his acupuncture meridian assessment. He's got 17 out of 20 meridians are out of balance. I know right away he's got large intestinal problem, he's got gallbladder meridian, liver meridian problem. I know where to look for. And it's not as complicated you may think. You know, whenever I talk about meridian assessment, this thing is so complicated, very difficult to learn, but it really is not. Especially you as a dentist, all you need is about 5 points to know on the right side and the left side. And it's not always easy to train the dentist, but it's not really that difficult. It's all mapped out for you thousands of years ago. And here's, you know, all those meridians are there, map out, but you just measure the point. And they will tell you whether it's you're balanced or out of balance. They'll give you a clue. So one of the points is called dental point. The heart meridian, small intestine, dental meridian. If those 3 points are out of balance, there's a 95% probability we're dealing with around your wisdom tooth areas. And after I put him on tinidazole and ivermectin for 2 rounds, when I saw him a couple of months later, all 40 out of 40 meridians balanced out just within a couple of months. So after 2 rounds of ivermectin and tinidazole, there was a dramatic increase in energy level and sense of oneness. First time in 4 years he was feeling back to normal again. And he's one of the most physically fit Air Force colonel, and he could barely function. He could barely stand up and be able to walk. And dramatic response with the parasite medication. But I'd just like to make a comment here. After initial dramatic response, his symptoms started coming back, which is very common, and had to be retreated again with more parasite medication. But he also had dental problems, heavy metal from mercury, lead, and nickel, and he's got multiple allergy problems that had to be addressed. And I convinced him to see one of the biological dentists in DC areas. I just found the name. I met somebody just out of blue. And he got some dental work done. He almost had complications. He died from the dental complications. He got some root canal out and cavitation work done. But I have no idea who I'm dealing with. And he almost had died from the actual dental operation. And he never actually fully recovered from after that episode. So just give you an idea how the important dental work is. And when he initially got very well, I thought maybe I'd get a phone call from White House, but I never did. And after he had all the complications from the dental work, I was afraid I may get a phone call from White House again, you know. So I'm glad they didn't call me, you know. But actually a few months later, I got an invitation by his White House staff physician. He's in charge of taking care of vice president and below from the White House staff. And I went to Andrew Air Base in September 2009. And they have a called Pentagon Flight Medicine Annex, and showing what I was doing. And they do have acupuncture clinic. And I've been told that congressmen like to go here to get us some acupuncture. So our taxpayers' money is actually apply for the acupuncture clinic right here. And they do have an acupuncture clinic. And so why it is important? Now, how do we know what kind of parasites and what kind of medication to use? This is a very important question. And how can you also detect hidden dental problems? Now, today we talked about biochemistry. Dr. Haley talks about biochemistry. We talk about genetics and epigenetics. We talked about nutrition. And you all know about the biomechanics importance of TMJ and bite problem. But Dr. Masavoy briefly touched about biophysics. And I'm talking about biocybernetics. So what is biocybernetics? That's understanding biomechanical, biochemical, and biophysics and information where the problem is. And that is based on acupuncture meridians. It's been mapped out thousands of years. But the German medical doctor, Dr. Voll, figured out how to actually measure about 60 years ago. So the concept of biocybernetics is a new frontier to understand the dental problem and the medical problem. And in this group here, we have one of the best experts understanding this biocybernetics on dental. That's Dr. Cook. Is Dr. Cook here? Oh, there he is. I learned the basic concept from him almost 20 years ago. And that's still so relevant. Why people are getting well. We have to understand the concept of the biocybernetics, the information, not only biomechanical, but biochemical, but also biophysics, where the problem might be. These are all mapped out for you thousands of years ago. We just figured out how to measure it. I just say it's not that difficult as you may think. All those fancy computerized programs make it very confusing. All you need is about 5 points in your right hand, 5 points on your left hand as a dentist figure out what kind of dental problem your patient may have. So I want you thinking about Parasite when the latest medical therapy failed. This is from Cleveland Clinic Medical Journal about 55-year-old man who died from congestive heart failure and cardiomyopathy. Dr. Boyd Haley talks about somebody with congestive heart failure and cardiomyopathy with the mercury toxicity. This particular patient actually died from parasite. Only found out after the autopsy, the lung biopsy shown, it will be hard to see, but there's a strongyloid there. So if you have heavy metals, it will suppress your immune system, make you more vulnerable to viral, bacterial, fungal, and also parasite problem. If you get rid of the parasite and fungus and bacteria, but if you don't take care of all the environmental toxins and mercury, you're going to get reinfected again and again. That's why you have to put this in a holistic approach to cover all the bases. And I know you cannot read this, and how do we get transmitted with a parasite? And he said, one of them is in the air. From the eggs, it's floating in the air. So you cannot get away with it. We all get parasite all the time. It's not a bad thing for you to go through natural herbal parasite medication at least a couple times a year to get rid of the parasite. But by the time you have a cancer, by the time you have a fibromyalgia, by the time you have all those incurable medical symptoms, we may need actually prescribed parasite medication. I try all those natural parasite remedies. They are simply not strong enough, at least in my experience. But when I combine the natural herbal parasite medication with proper prescribed medication with all those homeopathic remedies, I began to see some of those dramatic cases where sometimes cancer disappears, the brain lesion disappears in MS patients. It's almost hard to believe it. That's why I decided to write a book, and I wrote a book called Accidental Cure, because I just stumbled into this. And we talk about nutrition. You can get the finest nutrition, but if you have a parasite, it's not going to do you any good. That's why I always address the parasite issues as a main problem. That's always associated with any kind of chronic illness. So look at the multiple signs of parasite. Parasites speak many languages as symptoms, from gas, bloating, grinding teeth, coughing at night, weight loss, weight gain, obesity, underweight, lethargy, fatigue, sexual dysfunction, migraine headache, vision problems. I've seen some of the patients going blind, told them to apply for Social Security for blindness, put them on triple parasite medication, and they get their eyesight back. Craving for food, eosinophilia, bruxism, allergy problem, or it may actually suppress the allergy. You can have an immune deficiency syndrome, mental behavioral problems, what we call ADD, ADHD children often have a parasite problem, constipation, diarrhea, psoriasis, a lot of skin problem associated with a parasite, allergy problem, pain, all this joint pain, irritable bowel syndrome, waking up at night, bed wetting, night terror is another one associated with the parasite problem, night sweat, fever of unknown origin, rectal itching, muscle joint pain, and cyst and tumor. The list goes on and on. This is one of the most common problems you'll see. These are some of the herbs I use for parasite. And let me see, I think I have 10 more minutes. These are all the medication I use. Now, I start with mebendazole and parental pomade when I came back from Bolivia, because this is what we use. Before that, I never used parasite medication. And I've been doing EAB about 5 years or 7 years before that, and I said, what the hell, if the U.S. government sponsored this kind of a dispensing, everybody for the mebendazole and parental pomade, let me try this. And I started using this mebendazole and parental pomade as one of my first line of a drug of choice. And I see this dramatic response. The asthma goes away, the migraine headache goes away, so many pain goes away. Sometimes there's what called tumor disappears. But I realized that I have to use a much higher dose, and I have to use multiple medication in cycle. We have to go through the what called moon cycle, because many parasites follow the moon cycle. So you have to go through at least 2 or 3 times with different combinations. Some of them are for the large worms, but also some of them for microscopic parasites. So you use combination like ivermectin, parental pomade with either tinazole or Alinea to kill 2 different spectrum of the parasite. Because these parasites, as a community, have multiple parasites. You have to kill them all. So many asthma patients respond to parasite medication because these parasites go through their outside of the intestinal tract. They love to go to the lung, to your heart, and respond to parasite medication very well. So many what we call irritable bowel syndrome, ulcerative colitis, and Crohn's disease respond to parasite medication. Always put them on no grain or gluten-free diet. Diabetes, I always look for parasite, whether people respond to it or not. And parasite medicine may not cure the diabetes, but make their diabetes so much more easily manageable. I have a 10-year-old girl with type 1 diabetes, put her on Alinea, and back to normal in her blood sugar. Respond very quick, very fast. Here's another case study here. 49-year-old woman with breast cancer, multiple chemical sensitivity, and she had a serous post 9 cavitation operation. She had all those fillings out and 9 cavitation operation. And she's what we call classic weird patients. And those people who are so sensitive, she's, drove 3 hours to see me in a wooden chair, her van. She'll wear wooden shoes. Everything is so incredibly sensitive to everything. And she got 32 out of 50 meridians are out of balance. She's got burning pain in her chest and breast. She's got lots of dental problems, had 9 cavitation operations. She could not tolerate those parasite medications. I had to start her on homeopathic remedies, very low dose homeopathic remedies to build her up. Took it about a year. And gradually I was introducing parasite medication, tinazole, mebendazole, parental pomade, Alinea, ivermectin, in different combinations to make her strong enough. And then finally sent to the dentist again for number 17 cavitation work to be done 1 year later. And she's been holding it for the last 4 years. She's doing very well. Cavitation work couldn't hold it because her system was so run down. So we have to build that body up first before you do any more dental operation to be done. migraine headaches. So many of these migraine headaches respond to parasite, and almost always I would pick up from gallbladder meridian. This is from the fourth toes. It affects the knee, hip, back problem, indigestion, lung, level, neck pain, and headache. There's a class called migraine headache from gallbladder meridian and respond to parasite medication, especially called ocular migraine headache. Epilepsy and seizure disorders, always look for dental on wisdom tooth areas, and also parasites are very common problems. I always look for dental as part of my equation. So for today's lecture, I decided to combine parasite and dental, but I also always think about dental as part of my medical evaluation. This patient has 7 root canals, have a heart attack, unexplainable pain and fibromyalgia and fatigue. Once we remove all that 7 root canals, his chest pain went away. Always look for food allergies when the latest medical therapies fail. These are people with all this what called irritable bowel syndrome with a lot of food allergy problems. I check for IgG food antibodies for delayed hypersensitivity. And always look for nutrition when the latest medical therapy failed. I know Dr. Ramey covered these topics. In 100-year period from biblical David change from transformation from this to that. It's more than just a diet. So we're talking about epigenetics and environmental pollutions where he has now 50 pounds overweight or 100 pounds overweight. He's got hypertension, diabetes, erectile dysfunctions, fatigue, and all those problems. It's a part of the environmental package deal, genetics and epigenetics. Think heavy metals when the latest medical therapy failed. Mercury, lead, cadmium, aluminum, nickel, uranium. Uranium is a lot more common than you may think, but you have to look for it, and it's there. Tungsten, arsenic, gallium, platinum, bismuth, copper. I have a 23-year-old kid with a colon cancer with extremely high copper levels. You just have to look for those. And whenever there's really a tough case, I do what we call color therapy to unmask hidden dental and parasite problem. So how does color therapy fit in? You know, all those color have its own wavelengths and its own frequency, musical note. And the things I do with that color therapy is I can use either photon as a light, or I can use color as a frequency, depends on the equipment you have. And you can flash in this photon light, either blue or red or green or yellow. And then you check the EAB meridian system, and it may have a perfectly normal reading. The dental reading is perfect at 50. That's what we call balance. You give them flash the color, and check again in a few minutes later, and we'll see the dental problem reading drop down to 20. There's a hidden problem that we can see, that we can unmask. Or it could be a liver problem, or a gallbladder problem, or a hidden parasite problem we can see using what we call color therapy. It's something new. I never heard of it. I was just playing with it, and I just accidentally found it. So I just call it, that's what they call accidental cure. But color plays a very powerful role for not only for the healing, but it can help you call color contrast, unmasking hidden dental problems and hidden parasite problems. So let's go back. I'm basically done with my lecture here. The objective for this lecture to recognize that the parasites are often overlooked for common medical problems in actually entire medical practice and dental practice. We have a new way of detecting parasites by using current technology based on EAB and acupuncture meridian assessment. And you have a member here, Dr. Cook. He's one of the masters in dental to pick up this important concept of biocybernetics. And it's not that difficult as you may think. You can learn this in short time. And how to optimize using parasite medication, that's from try and errors for the last 10 years. I realized that you have to use a different combination at high dose, and you have to cycle them in combination with the natural herbs and homeopathic remedies. And I have a very good success rate. and prevent from recurrent parasite infection by understanding parasite is a very common problem we overlook. And we can use like a color therapy to detect any hidden problems. And to understand the incurable dental medical problems that are also related with a hidden parasite problem. So we have to be a partnership as a dentist and the medical doctors. Only problem is there aren't too many medical doctors who understand the dental problems, and there aren't too many the dentists understand medical doctors who understand this kind of problem. This is really a dilemma. I'm trying to promote this concept, and it is in my book explaining this phenomenon. So I'm a doctor. Dr. Ferguson, I just talked to him. He's from Kansas City. He read my book. He said he really liked my book, and he ordered a case, and he was giving out to his referral physicians to see why it is important. Because if he's promoting his own dental practice, it's like a self-promotion. But there's an MD who's talking about the importance of dental connections, and he actually giving more referral basis his dental practice by giving the book to the actually medical doctors to see the connection. You have to recruit your medical doctors. For me, I recruit the dentists. Dr. Ramey, Dr. Schulman, Dr. Willie as a dentist. I have a Dr. Morgan as an oral surgeon. I do have a team in St. Louis I can refer to. When everything else fails, I send to Dr. Cook in Wisconsin. I don't always agree with him. I may have I have a problem with number 17 in my patient, and I'll get the patient back and say, no, you're wrong. The patient has a number 32. I don't know who is right. He's been doing it for 50 years. I've been doing it for about 20 years. So I don't always get the same kind of response, but the important thing is we all agree that, yes, there is a dental problem. Most likely that patient have a number 32 and number 17. But I'm just picking number 17 as a priority problem, and he may pick up number 32 as a priority problem. So if you take care of number 32, a few months later when you check, number 17 will show up. It's almost always they do that. So let's see. I want you to think outside the box. Always look for nutrition, heavy metals, parasite, focal infections, dental problem, allergy problem, environmental toxins, and also emotional, spiritual level detoxification, and also what I call X factor, the unknown. I'm sure there's more unknown than we may think, but I always look at this dental as a part of my medical evaluation, and I need a dentist to work with me together, and you need a medical doctor to work with you together. You have to recruit your medical doctor who understand it. So I want you to think differently, thinking about parasite, dental, and acupuncture meridians. And here's my book, Accidental Cure, explaining all that phenomenon, why it is all interconnected. So thank you for invitation.